Have you ever wondered if your body tries to warn you before something serious happens? The truth is, it does. And when it comes to heart attacks, those warnings could save your life. Hello and welcome to today's video. I'm glad you've joined us for this critical discussion about something that affects millions of people worldwide every year. Imagine this scenario. John, a 72-year-old retired teacher, had been feeling unusually tired for weeks. He noticed mild pressure in his chest occasionally but dismissed it as indigestion. One morning while gardening, the pressure intensified, his left arm felt heavy, and he broke into a cold sweat. Fortunately, his wife recognized these signs from a video just like this one and called 911 immediately. The doctors later confirmed he was having a heart attack, and because of that quick action, John made a full recovery. Stories like John's aren't rare. Every year, about 805,000 Americans have a heart attack, and for many, the outcome isn't as positive. But here's the crucial point. Your body typically doesn't suddenly betray you without warning. In approximately 50% of cases, people experience warning signs days, weeks, or even months before a major cardiac event. These warning signs are like whispers from your heart trying to tell you something's wrong. The problem is, we often don't recognize these whispers until they become shouts, and by then it might be too late. As someone who has spent decades studying cardiovascular health and working with seniors, I've seen firsthand how recognizing these early warning signs can make the difference between life and death, between a minor medical intervention and major heart damage. Today, I'll walk you through the 6 most critical early warning signs of a heart attack that you absolutely must know. I'll explain what they feel like, why they happen, and most importantly, what you should do if you experience them. This isn't about causing unnecessary worry. It's about empowering you with knowledge that could save your life or the life of someone you love. So please, get comfortable, perhaps take some notes, and let's learn together how to listen when our bodies try to warn us. Before we dive into the specific warning signs, let's understand what we're dealing with. Heart attacks, or myocardial infarctions as medical professionals call them, occur when blood flow to a part of your heart becomes blocked, usually by a blood clot. When this happens, that section of heart muscle begins to die from lack of oxygen. For those of us in our golden years, the statistics paint a sobering picture. Adults aged 65 and older account for more than 85% of all heart attack deaths. After age 65, the risk of having a heart attack doubles for men and triples for women compared to younger adults. And perhaps most concerning, the American Heart Association reports that nearly half of all heart attacks in seniors are silent, meaning they happen without the person even realizing it. Why is early detection so crucial? When you recognize the warning signs and seek immediate medical attention, doctors can often restore blood flow to your heart before permanent damage occurs. Every minute counts. Medical research shows that survival rates improve by up to 23% when treatment begins within the first hour of symptom onset. Simply put, recognizing early signs doesn't just reduce damage, it saves lives. Unfortunately, many misconceptions about heart attack symptoms persist, particularly among older adults. The most dangerous myth is that heart attacks always present as dramatic, chest-clutching events like we see in movies. The truth is far more nuanced. For many seniors, especially women, symptoms can be subtle and easily attributed to other conditions like arthritis, indigestion, or normal aging. Another common misconception is that chest pain must be severe and crushing to indicate a heart attack. In reality, many people, particularly women and older adults, experience milder discomfort or pressure rather than acute pain. Some have no chest symptoms at all but show other warning signs we'll discuss today. Many also wrongly believe that heart attacks happen suddenly without warning. While this can occur, research from the American Heart Association indicates that approximately 50% of heart attack survivors recall experiencing warning signs hours, days, or even weeks before their event. Understanding these facts and dispelling these myths is the first step toward protecting yourself. Knowledge truly is power when it comes to your heart health. When people think of heart attacks, chest pain is usually the first symptom that comes to mind. However, what many don't realize is that this warning sign doesn't always present as the dramatic, clutching pain portrayed in movies. Let's explore the various ways chest discomfort might manifest before a heart attack. For many people, especially older adults, chest sensations can be quite subtle. You might experience a feeling of pressure or tightness, as if someone is squeezing your chest or as if a heavy weight is sitting on it. Some describe it as a fullness or a squeezing sensation in the center of the chest. Others might feel burning or a sensation similar to heartburn. What's particularly important to understand is that this discomfort can come and go. It might last for a few minutes, then disappear, only to return later. This intermittent nature often leads people to dismiss it as something minor. Some of my patients have described experiencing these sensations for days or even weeks before their actual heart attack. The location matters too. While the discomfort is typically centered in the chest, beneath the breastbone, it can sometimes be felt slightly to the left side. It rarely manifests as a sharp stabbing pain in one precise spot. That's actually more characteristic of non-cardiac issues. How can you distinguish this warning sign from other conditions? This is admittedly challenging, as several conditions can cause chest discomfort. Acid reflux or GERD can create burning sensations that mimic heart-chest pain. Muscle strains, particularly after physical activity, can cause soreness in the chest wall. Anxiety can trigger tightness and pressure sensations as well. The key differences often lie in the triggers and relief patterns. Acid reflux typically worsens after eating certain foods and can improve with antacids. Muscle pain usually intensifies with specific movements and may feel tender to the touch. Anxiety discomfort often occurs during stressful situations and eases with calming techniques. Heart-chest discomfort, however, often occurs with exertion and improves with rest. It's typically not affected by your body position, eating habits, or touching the area. And critically, it may be accompanied by other symptoms we'll discuss later in this video. When should you take chest discomfort seriously? The answer is simple: always. While not all chest discomfort indicates a heart problem, it's impossible to definitively know without medical evaluation. If you experience new or unusual chest sensations, particularly if they last more than a few minutes or return repeatedly, don't try to self-diagnose. This is especially true if you have risk factors like high blood pressure, diabetes, high cholesterol, or a family history of heart disease. Remember Martha, one of my dear viewers who wrote to me last year? She experienced mild chest pressure for 3 days but dismissed it as stress. When her arm began tingling, her daughter insisted they call 911. Tests revealed a 90% blockage in one of her coronary arteries. That prompt action likely saved her life. Your body is trying to tell you something. Please listen. The second early warning sign we need to discuss is one that's frequently overlooked, yet can appear weeks before a cardiac event: unexplained fatigue. This isn't the normal tiredness you might feel after a busy day or poor night's sleep. This is a profound, unusual exhaustion that seems disproportionate to your activity level. Many survivors describe this fatigue as feeling suddenly drained or overwhelmingly weak, without any clear reason. Simple tasks that never troubled you before, like making the bed, taking a short walk to the mailbox, or even carrying on a conversation, suddenly leave you feeling completely depleted. One gentleman in my heart health support group recalled needing to sit down to catch his breath or simply getting dressed in the morning, something that had happened daily for about 2 weeks before his heart attack. What makes this type of fatigue different from normal tiredness? Normal fatigue typically follows periods of exertion or poor sleep that improves with rest. Heart fatigue, however, doesn't follow this pattern. It often appears suddenly, persists despite adequate rest, and may worsen over time. You might find yourself needing naps during the day when you've never needed them before, or waking up feeling as tired as when you went to bed. This warning sign is particularly problematic for seniors because it's so easy to attribute to aging or other conditions. Many older adults assume increasing fatigue is just part of getting older. Healthcare providers might initially consider conditions like anemia, thyroid issues, depression, or medication side effects before considering cardiac causes. Family members might notice the change but not recognize its significance. This leads to dangerous delays in seeking medical attention. To understand why fatigue occurs before a heart attack, we need to appreciate the connection between your heart's function and your energy levels. Your heart is responsible for pumping oxygen-rich blood to all your tissues. When coronary arteries begin to narrow due to plaque buildup, the process that eventually leads to most heart attacks, your heart struggles to pump efficiently. This means less oxygen reaches your muscles and other tissues, resulting in fatigue. Think of it like a garden hose with a partial blockage. The water still flows, but not at full capacity. Your body, sensing this reduced oxygen delivery, conserves energy by making you feel tired. It's actually a protective mechanism, trying to reduce your activity level to match your heart's compromised pumping ability. This fatigue may be more noticeable during physical activities, but can be present even at rest. For some people, particularly women, unusual fatigue can be the most prominent pre-heart attack symptom, sometimes appearing without significant chest discomfort. If you're experiencing unexplained exhaustion that's new, persistent, and doesn't improve with rest, please don't dismiss it as just getting older. It deserves medical attention, especially if you have other risk factors for heart disease. Our third critical warning sign is shortness of breath, which can occur before or during a heart attack, sometimes even without chest discomfort. This isn't the normal breathlessness you might experience after climbing stairs or during physical activity. This is unexplained difficulty breathing that seems out of proportion to your level of exertion, or occurs even at rest. Many heart attack survivors report experiencing unusual breathing difficulties in the days or weeks before their cardiac event. They describe feeling as though they couldn't get enough air, needed to sit up to breathe comfortably, or felt winded after minimal activity. Some wake up in the middle of the night gasping for air or need to prop themselves up with extra pillows to breathe comfortably while sleeping. To understand why this happens, we need to explore the connection between your heart and lungs. These two vital organs work as partners in delivering oxygen throughout your body. When your heart isn't pumping efficiently, which can happen when coronary arteries become narrowed before a heart attack, blood can back up in the vessels that carry oxygen-depleted blood from your lungs back to your heart. This causes fluid to leak into the lungs' air sacs, making breathing more difficult. Think of it as trying to breathe through a damp sponge rather than a dry one. Your lungs can't exchange oxygen and carbon dioxide as effectively when they're dealing with this excess fluid. Your body responds by making you breathe faster and more deeply to compensate for the reduced efficiency, creating that sensation of breathlessness. How can you distinguish cardiac breathing problems from other causes? Respiratory conditions like asthma, COPD, or respiratory infections typically include additional symptoms like wheezing, coughing, or phlegm production. Cardiac shortness of breath often occurs without these symptoms and may worsen when lying flat. Another important distinction: breathing difficulties caused by heart problems frequently worsen with exertion and improve with rest, similar to chest discomfort. They may also accompany other symptoms we're discussing today, like fatigue or chest sensations. When should shortness of breath become a serious concern warranting immediate medical attention? Any sudden or severe breathing difficulty is always an emergency. But even milder breathing changes deserve prompt medical evaluation. When they appear suddenly without an obvious cause. They worsen over time, especially over days or weeks. They occur along with chest discomfort, sweating, nausea, or arm pain. They wake you from sleep, what doctors call paroxysmal nocturnal dyspnea. They occur when you're at rest or with minimal activity. They represent a change from your normal breathing patterns. I remember Robert, an 82-year-old gentleman who noticed he couldn't walk to his mailbox without stopping to catch his breath, something that had developed gradually over 3 weeks. His family insisted he see his doctor, who discovered significant blockages in his coronary arteries. After receiving stents, his breathing difficulties resolved completely. Your body's warning signals deserve attention. They're often trying to tell you something important about your heart's health. While chest discomfort is widely recognized as a heart attack symptom, Many people don't realize that pain in other areas of the upper body can actually be the primary warning sign, sometimes occurring without any chest sensations at all. These pain patterns, which doctors call referred pain, can manifest in the jaw, arms, shoulders, neck, and upper back. Let's explore these referred pain patterns and understand why they occur. Many heart attack survivors report experiencing pain that travels down their left arm, typically the inside of the arm from the chest to the wrist. This can feel like a heaviness, achiness, tingling, numbness, or frank pain. However, it's crucial to know that this discomfort can also appear in the right arm or even both arms simultaneously. One of my patients described it as feeling like someone had put a blood pressure cuff on my arm and pumped it too tight. Jaw pain is another critical warning sign that's often misinterpreted. It typically manifests as a dull ache or pressure in the lower jaw, sometimes radiating up toward the ear. Many individuals, particularly older adults, mistake this for dental problems. I've had several patients who actually scheduled dentist appointments before realizing they were experiencing a heart issue. Shoulder and upper back discomfort can feel like a deep ache between the shoulder blades, or pain radiating from the chest to one or both shoulders. Some describe it as pressure, soreness, or a burning sensation. Neck pain may present as tension, aching, or pressure, often on one side and frequently mistaken for a muscle strain. Why does heart pain radiate to these areas? The answer lies in our nervous system's wiring. The nerves that supply your heart and these other body regions originate from the same segments of your spinal cord. When your heart is in distress, it sends pain signals along these shared nerve pathways, creating confusion in your brain about the actual source of the pain. Your brain essentially refers the pain to these other locations, hence the term referred pain. Perhaps most important to understand are the gender differences in how these symptoms present. While men more typically experience the classic left arm pain, women often report more diffuse symptoms, including upper back pain, jaw discomfort, and neck pain. In fact, studies show women are more likely than men to experience heart attacks without any chest discomfort at all, instead experiencing these referred pain patterns as their primary symptoms. Older adults should be particularly vigilant about these non-chest pain symptoms. As we age, our pain perception can change, and these referred pain patterns may be more subtle or attributed to arthritis, muscle strains, or other age conditions. If you experience new or unusual pain in these areas, particularly if it comes on with exertion and improves with rest, or if it's accompanied by other warning signs we're discussing, please don't dismiss it. Even if it's not in your chest, it could be your heart trying to warn you. Another crucial cluster of warning signs that may precede a heart attack includes cold sweats, dizziness, and lightheadedness. These symptoms might seem disconnected from heart health at first glance, but they're actually directly related to your cardiovascular system's functioning. Let's start with the physiological explanation of why these symptoms occur before a heart attack. When your heart isn't receiving adequate blood flow due to narrowing coronary arteries, it triggers your body's stress response. Your nervous system activates, releasing stress hormones like adrenaline. This automatic response causes blood vessels in your skin to constrict, while simultaneously triggering your sweat glands. The result? Cold, clammy skin accompanied by unexplained sweating, what we commonly call cold sweats. At the same time, if your heart isn't pumping efficiently, it may not deliver sufficient blood to your brain. This reduced blood flow to the brain can cause dizziness, lightheadedness, or a feeling that you might faint. Some people describe it as feeling suddenly unsteady, woozy, or like the room is spinning. In older adults, these symptoms may present somewhat differently. Seniors may experience more profound dizziness that affects their balance or coordination. The sweating might be less noticeable or attributed to other common occurrences like hot flashes or night sweats. Many elderly individuals report a general feeling of weakness or unsteadiness, rather than classic dizziness. Some describe feeling suddenly disoriented or confused, symptoms that can easily be mistaken for other conditions common in older adults. How can you distinguish these heart symptoms from other causes? Dizziness can result from numerous conditions, including inner ear problems, medication side effects, low blood sugar, or dehydration. Sweating can occur with infections, hormone fluctuations, anxiety, or simply warm environment. The key differences often lie in the circumstances and accompanying symptoms. Heart dizziness and sweating typically occur unexpectedly, without clear triggers like missed meals or medication changes. They may worsen with physical activity and improve with rest. Most importantly, they often appear alongside other warning signs we've discussed, such as chest discomfort, unusual fatigue, or shortness of breath. Pay particular attention if you experience sudden sweating without apparent cause, especially if it's accompanied by a pale or gray complexion. This combination is especially concerning and warrants immediate medical attention. Margaret, a 77-year-old viewer, shared that for 3 days before her heart attack, she experienced episodes of feeling clammy and wobbly that would come and go. She initially blamed new blood pressure medication, but fortunately mentioned it during a routine doctor's appointment. Her doctor recognized the warning signs and ordered tests that revealed significant coronary artery disease requiring prompt intervention. These seemingly minor symptoms quite possibly saved her life. The sixth early warning sign we need to discuss involves digestive symptoms that many people would never connect to heart problems. Nausea, indigestion, abdominal discomfort, and sometimes vomiting can actually be signs that your heart is in distress. These digestive disturbances may appear days or even weeks before a heart attack. You might experience a sense of fullness or discomfort in your upper abdomen, feelings of nausea that come and go, or indigestion that doesn't seem to respond to normal remedies like antacids. Some people describe it as feeling like they've eaten a heavy meal even when they haven't. Others report a vague sense of queasiness or stomach discomfort that persists without a clear cause. Why do heart problems create these seemingly unrelated digestive symptoms? The answer lies in shared nerve pathways. The vagus nerve, which helps regulate both your heart and digestive system, can transmit confusing signals when your heart is experiencing reduced blood flow. Additionally, when your heart isn't pumping efficiently, blood flow to your digestive organs may decrease, causing them to function poorly and creating these uncomfortable symptoms. These warning signs are so frequently misinterpreted because they perfectly mimic common digestive conditions. Most people naturally assume they're experiencing heartburn, acid reflux, or a stomach virus. They might try over-the-counter remedies, dietary changes, or simply wait for the symptoms to pass, potentially missing crucial time for early intervention. For seniors, there are special considerations that make these symptoms particularly deceptive. As we age, digestive issues become more common in general. Many older adults regularly experience heartburn, indigestion, or stomach discomfort due to medication side effects, changes in digestive enzyme production, or conditions like hiatal hernias. This makes it all too easy to dismiss new digestive symptoms as just another stomach problem, rather than recognizing them as potential heart warnings. Additionally, many seniors take multiple medications, some of which can cause digestive side effects, further complicating the picture. Medications like aspirin, certain pain relievers, and some blood pressure drugs can cause stomach irritation, making it even more challenging to identify when digestive symptoms might be heart. How can you tell the difference? Heart digestive symptoms often differ from typical stomach issues in several ways. They may not have an obvious connection to meals. They frequently appear alongside other warning signs we've discussed. They might worsen with physical activity and improve with rest. And, perhaps most tellingly, they typically don't respond well to the usual remedies for digestive problems. I recall Howard, an 83-year-old gentleman who experienced persistent indigestion for nearly 2 weeks. When he finally mentioned it to his daughter, she wisely insisted on a doctor's visit. Tests revealed he wasn't experiencing a digestive problem at all, but was having warning symptoms of a heart attack. This underscores why any unexplained digestive symptoms, particularly those that persist or recur, deserve medical attention, especially for seniors with heart disease risk factors. Recognizing the warning signs we've discussed is only half the battle. Knowing how to respond appropriately can make the critical difference between minor damage and a life-threatening situation. Let's talk about the specific actions you should take if you notice these potential heart attack warning signs. First and foremost, don't ignore these symptoms or try to tough it out. Many heart attack victims, especially men, delay seeking help because they don't want to cause a fuss or feel embarrassed if it turns out to be nothing serious. Remember this: medical professionals would much rather rule out a heart attack than treat one that's progressed too far. No doctor has ever been upset about a false alarm, but they've certainly been heartbroken over patients who waited too long. If symptoms are mild but concerning, call your doctor immediately. Describe your symptoms in detail and follow their guidance. If your doctor advises you to come in right away, have someone drive you. Don't drive yourself. If your doctor is unavailable, proceed to the emergency room or urgent care facility. When should you call emergency services? Call 911 immediately if symptoms are severe or frightening. You experience chest discomfort lasting more than a few minutes. Symptoms don't improve after resting for 5 minutes. You have any combination of the warning signs we've discussed. You have a history of heart problems and experience new or worsening symptoms. While waiting for emergency responders, take these immediate actions. Stop all activity and sit or lie down in a position that makes breathing comfortable. If you're not allergic to aspirin and have no contraindications, chew a regular strength aspirin, 325 grams each, or 4 low-dose aspirin, 81 grams each. Loosen tight clothing, especially around your chest and neck. Try to stay calm and take slow, deep breaths. When emergency responders arrive, be prepared to tell them all symptoms you're experiencing, including when they started. Any history of heart problems or risk factors. All medications you're currently taking. Any allergies you have. The name and contact information for your doctor. Remember, minutes matter when it comes to heart attacks. The sooner you receive treatment, the better your chances for a full recovery. While recognizing early warning signs is crucial, preventing heart problems in the first place is always the best strategy. The good news is that there are numerous proven approaches to maintaining heart health even as we age. Let's explore the most effective prevention strategies that can significantly reduce your risk of experiencing a heart attack. Let's start with lifestyle modifications, which remain the cornerstone of heart disease prevention at any age. Regular physical activity is perhaps the single most powerful tool in your heart health arsenal. For seniors, this doesn't mean strenuous exercise. Moderate activities like brisk walking, swimming, or dancing for 30 minutes most days can strengthen your heart significantly. Always start slowly and gradually increase intensity. After consulting with your doctor about what's appropriate for your fitness level. Your dietary choices make an enormous difference too. The Mediterranean diet pattern has shown remarkable benefits for cardiovascular health. This means emphasizing vegetables, fruits, whole grains, beans, nuts, fish, and olive oil, while limiting red meat, processed foods, and sweets. Reducing sodium is particularly important for seniors, as our sensitivity to salt's blood pressure-raising effects typically increases with age. Managing stress effectively also protects your heart. Techniques like deep breathing, meditation, gentle yoga, or simply spending time with loved ones can help reduce the harmful stress hormones that damage blood vessels over time. Many seniors find that having a pet provides both companionship and stress relief, with studies showing measurable cardiovascular benefits. Regular medical checkups become increasingly important as we age. Schedule comprehensive checkups at least annually, including blood pressure monitoring, cholesterol testing, and diabetes screening. Don't hesitate to discuss any new symptoms, even seemingly minor ones, with your healthcare provider. Many seniors benefit from seeing a cardiologist periodically, especially if they have risk factors like high blood pressure, diabetes, previous heart problems, or a family history of heart disease. Between doctor visits, home monitoring can provide valuable information. Consider regularly checking your blood pressure with a home monitor, tracking your weight for sudden changes, and being aware of your heart rate patterns. Many modern smartwatches and fitness trackers can help monitor these metrics, though they shouldn't replace professional medical care. Medication adherence is absolutely critical. If your doctor has prescribed medications for conditions like high blood pressure, high cholesterol, or diabetes, taking them exactly as directed is essential for heart attack prevention. Use pill organizers, phone reminders, or other systems to ensure you never miss doses. Finally, don't underestimate the heart benefits of good sleep and social connections. Aim for 7 and 8 hours of quality sleep and maintain active relationships with family and friends. Research consistently shows that strong social ties correlate with better heart health and longer life. By incorporating these prevention strategies into your daily life, you're giving your heart the best possible chance to serve you well for many years to come. As we wrap up our discussion today, let's take a moment to review these critical early warning signs that your body might be trying to alert you to an impending heart attack. First, be vigilant about any unusual chest discomfort, whether it's pressure, tightness, or burning sensations. Second, pay attention to unexplained fatigue that seems disproportionate to your activities. Third, notice any new or worsening shortness of breath, especially with minimal exertion or while resting. Fourth, never ignore pain in your jaw, arms, shoulders, or back that can't be explained by injury or strain. These referred pain patterns often signal heart distress. Fifth, take cold sweats and dizziness seriously, particularly when they occur without obvious cause. And sixth, be aware that digestive disturbances like nausea and indigestion can sometimes be your heart trying to warn you, not just a stomach issue. Remember, you have tremendous power over your heart health. While we can't control factors like our age or family history, we can influence so many other aspects of our cardiovascular well-being. Each healthy meal you choose, every walk you take, each doctor's appointment you keep, these are all acts of self-care that can significantly improve your odds of avoiding heart problems. I truly believe that knowledge is power, especially when it comes to our health. By learning these warning signs, you've already taken an important step toward protecting yourself. You're now equipped to recognize these subtle signals your body might send and respond appropriately. Please share this information with your loved ones. Heart disease remains our #1 health threat, but together we can change that. Subscribe to our channel for more life-saving health information tailored for seniors. Leave a comment below with any questions. I read every one. And remember to click the notification bell so you never miss our weekly health videos. Thank you for joining me today. Your heart has been faithfully beating for you every moment of your life. It deserves your attention and care. Until next time, this is Your Name, wishing you vibrant health and many more happy, healthy years ahead.